Hi, this is your Houston chiropractor, Dr. Gregory Johnson, and today we are going to be going over the treatment and how you treat a patient who has had failed neck surgery with fusion and instrumentation, and he has been disabled now since 2005 when he had his injury. He had neck surgery in 2007, and his life has just had a downward spiral ever since that point in time. He's been unable to work, been unable to function at his home or in his normal activities of daily living. He was referred here by another patient who had had 4 failed back surgeries, and we have just started his treatment. But already in the short period of time that we've started his treatments, this will be his 3rd treatment, he has started improving in his function of able to walk a little bit more, get around, drive a vehicle. So we're going to show you how we do this. So first thing I'm going to do is analyze his posture like we always do on the x-axis, the y-axis, and then the z-axis. So Johnny, let's have you close your eyes, flex your head forward all the way. And you see he has very limited range of motion there. Now backward all the way. That's it right there. He's stopping at about 15 degrees. Now back to normal. Keep your eyes closed. Take a deep breath. I want you just to relax. Now, as you can see, he has a severe translation on the x-axis to the right. He has a rotation on the z-axis, also to the right. You can see that his right ear is way lower than his left ear. And you can see the significant rise in his left shoulder. Now from this view, you can also see that what this has done because of nerve damage out of his cervical spine, he has problems all the way down into his left arm and hand, and his fingers actually now are curling up on their own. They've become spasmed like trigger fingers because he's pinching the nerve out of that area where he's had surgery. So here's what we're going to do. We're going to have him come over here and lie down on this table. And now he has to take this real slow. He's been used to walking with a cane for so many years that it's really become a crutch for him, and he's not even been able to get around like this. But we're going to get him into a position where he doesn't have to use that cane so often. And as you can tell, it's difficult for him to even move around and get on the table. Go. This is how severe a patient can get when they do not seek chiropractic care first and go through these surgeries and chronic pain management. Scoot all the way up in here for me, Johnny. There we go. A little bit more where you face it all the way up in there. See, it's just very difficult for him to move at all, has very little strength. We've done a very comprehensive examination on him, looked at all his medical records, and you can just relax these arms down like you did yesterday there. Now, let your head relax right down in there. Now, you can see just by looking at his spine that he has a severe scoliosis all the way down. Look at how his ankles have swollen. He has what's called pitting edema down here now. His right leg is 1/2 of an inch shorter than his left leg. Now I'm going to bring it up. Now he's got such severe problems in his left knee, that's all I can bring it up. But we bring the right one up. That causes his low back to hurt though, doesn't it? Right there. So we let those down nice and easy. And the very first thing that I'm going to do, because his pelvis was also translated to the left in the x-axis, is we're going to move that back over to the right in the x-axis. I'm going to adjust his right sacroiliac joint in the x, y, and z axis. Now I'm actually getting right on the inside of the right aspect of the sacrum, or the middle triangular shape bone. This is a Y and Z adjustment on that left side, or right side of the sacrum. This is the left side of the sacrum. This is the left sacroiliac joint. Now you'll notice I use a lot of different moves and torsional thrust. There we go, perfect. That went in. Now there's L5. That's really tender, isn't it, Johnny?
Yes, sir.
See, his low back, he's just lost the curve in his low back because of muscle spasm. So right here, we're adjusting L5, L4, L3, L2, there's L1, and now just breathe normal for me. And we got to take it really pretty easy here at first. This is only his third treatment. His spine has developed so much fibrotic scar tissue that these manipulations are very, very difficult at best. So what we have to do is use a lot of muscle work. Now right down here I'm in his quadratus lumborum, multifidus, and erector spinae muscles, right where his low back meets his pelvis. That's pretty sore too, isn't it?
Yes, sir.
And then again right here on that right side, which is, and this right at the base, he's just got spasm everywhere. There's no wonder he hasn't been able to walk normally. Nice and easy. Take some deep breaths. I know these are very painful. But what we're doing is we're breaking up some of this fibrotic scar tissue that has developed over the years since 2005 when he first had his injury. By the way, he was injured when he was lifting up some heavy logs and trying to throw them into the back of a truck, and actually one of the logs came back and hit him in the neck. And that's what started this whole mess for him and has changed his life dramatically from being a productive, happy person into a totally disabled, unhappy person who has been unable to function in his normal everyday activities of daily living. So the reason that he is here is for us to, now see his legs are exactly even. We're going to bring these up again. Now you still see his left leg still short, but look how much further we go with that right leg. That didn't hurt as bad, did it, Johnny?
No.
Good. Now, because he's got such a severe cervical spine, plus he has a plate in there fusing C5 and C6, I am going to be using a very specialized high velocity, low amplitude adjusting instrument where we are going to be adjusting his C2 right there, and I'm adjusting right now on the Z and X axes. Now right here we're actually going to be getting right down on the first rib because this left shoulder is severely elevated. Now we're in his trap. When I do this, we get a excellent. We get a rebound phenomena. Now right here I'm going to actually be adjusting his skull straight up on the occiput in the y-axis. I cannot decompress his spine at this point in time because of the cervical fusion with instrumentation. So we have to approach his condition completely different. Let's scoot all the way up into the headpiece there. Right there. There we go. Excellent. Now just relax everything down. We're going to be using a tool called a terminator. This is a tool that I use to break up fibrotic adhesions. And he's going to be feeling this all the way up and down the spine. Paraspinal muscles. artificially tight. We're getting in here and breaking up some of this fibrotic scar tissue and adhesion. And I know these are really tender for him. But you can see the severe scoliosis in his spine all the way down. Yes. Now we're actually going to be using a very deep vibratory element here on his calves. This is a very significant aspect to his treatment because we're increasing the blood flow to the tissues, stimulating the muscles, and it allows the blood to carry in critical oxygen and nutrition into the muscle cells and to carry out metabolic waste products from cellular metabolism out of the cells. Plus, after using that very deep myofascial release instrument that I just used called the Terminator, we're going to go over these and increase his circulation so he can get rid of a lot of these metabolic waste products from cellular metabolism and expel those. And we have him drinking about a gallon of water a day right now just to help us expel all that. Very good. Now I'm putting a great deal of pressure on this, so this is not just a rubby feel-good treatment, although it does feel good. He's got knots all through his spine. Very good. Okay, and then now what we're going to do is we're going to have him come back over here. So let's go ahead and we're going to have him get up off that table. Now he wasn't even able to get down on this table the very first time I met him. So let's just, there you go. Come off there whichever way is easiest for you. Yep. Make sure he doesn't fall off on the floor. He doesn't need any more trauma. Here you go. Let me help you up here. Okay. See, he's got a lot of weakness in that right extremity. Let me help you up here now. There we go. I'm going to sit up here. Got it? Okay. There we go. That's all right. You're okay. You're okay. There we go. There we go. Now, we're going to help him walk back over here. Now see, he's already standing up straighter from the side view. He had about a foot of forward head posture when we first got started. So we're going to come back over here in front of the mirror. You just stay right there and do the side view on this one. I'm going to plug this instrument back in. What I'm getting ready to do right now, and just stand right there for me, and put your feet a little further apart for me, Johnny. What I'm going to do right now is called mirror image adjusting, and I'm going to be using, again, this high velocity, low amplitude instrument. We're going to mirror image his entire biomechanics, put him into a much better biomechanical alignment by mirror imaging this, and then I'm going to adjust his atlas on both sides and his skull with this high velocity, low amplitude instrument, and watch how it changes his posture. So, first thing I'm going to do is have you pull up here, hold those back. Now, we're going to have to put a lot of pressure on him here. Let that neck go. Now I want you just to shift totally this way and lean backwards. I got you. Excellent. Hold that position right there. I got you. And we're going to get this low back right there. Very good. Okay, now, I'd like for you to close your eyes again. Flex your head forward all the way, as far as you can go. See, we've already improved the range of motion there. Now backwards as far as you can go. And look at the difference on the range of motion already. Now normal. I can't even begin to tell you how much this has improved his posture. You can open your eyes up now. Take a look at that, Johnny. How's that feel? Better, huh?
Yes, sir.
Now,
I feel better.
take a look at him from the front so they can turn around this way and face the camera. And just look how much this has changed his biomechanics and posture from one adjustment. This is only his third treatment, and he's able to actually stand up without the use of the cane now and get around. So I just want those of you who have had surgery to your neck or low back, either one, anywhere, to know that you can actually get help and biomechanically corrected with chiropractic biophysics after surgery even, and do things that medical treatment and chronic pain management programs cannot do. So I want how do you feel about that? Do you feel this is the best treatment you've had out of all the treatment you've had since 2005?
This is the best.
Great. This is your Houston chiropractor, Dr. Gregory Johnson. We'll see you next time.